Thank you, Kusum and the college for inviting me for this communication or a kind of a brief discussion. I don't want to call it a lecture because these are things that we day-to-day practice. But just to re-polish or to share our knowledge, how each one is dealing with difficult patients. So I would be discussing, therefore, please communicate when I ask questions, discuss because all colleagues, friends, and therefore try to, without allowing me to be a dominator here, we all will contribute and discuss, right? Despite I'm just have made few slides. What is actually a difficult patient? You can divide that into two groups. Number one, it's a patient's factor, patient's attitudes or behavior, those factors. It's a different thing, not in the eye, but specifically the eye-related conditions as well. I will not be focusing on the eye-related things here because that's a vast subject. From case to case is different. Therefore, I don't think it is. And even if I try to, give a lecture more practical, getting involved or looking at the videos in those cases. But I will tell you how you win the heart of the patient. Now, if you see, if you look at me, I will tell you why I select this topic. I really enjoy my work. I see a lot of patients. Now my number of patients are not limited by the number of patients coming in. By the limit is actually by my time, and I have limited. So there should be a reason for that. When I don't have a ward, I don't have a established, health ministry support, the other support. I have develop up to that level so that I have been able to develop a good practice. So I have some, nothing secret, no extraordinary skills or nothing, just like you guys. I am also the same kind of a person, but I slowly develop a practice. That the only things, the certain things that I applied during that practice, I am going to tell you now. So who is a difficult patient? Give me 1 minute. A difficult patient is both those with challenging attitudes and expectations, and those presenting with complex cataracts, which I am going to put aside without discussing. And our aim is to enhance the patient's satisfaction, optimize the outcomes, and minimize the professional stress, all grounded in scientific evidence. The things that I prepared this lecture actually after going through so many abstract. I didn't go through the, I will tell you how I did these slides also. I searched the net PubMed, looking at how you deal with difficult patient, how to relieve the anxiety in ophthalmology related using the keywords. I searched the web and I went through most of the abstracts. And if it is relevant, I went through those particular sections also in the text. And most of the facts that I am telling here are taken from the scientific articles, not my, I have mixed it with my experience. So challenging patients are patients with attitudes. You have seen so much of abnormal, unexpected attitudes is when it comes to the patient. But unfortunately, you have to deal with those patients being a doctor, right? Our aim is to, we also should not be stressed out with because of the patient. It is patient's problem. So you should not take that into your account, but sympathizing that you have to look into the patient and solve the problems, whatever you can help that patient. So why patients get stressed? So you have to understand that in life, anything, when you deal with another person, patient, either patient or a person, you have to see first why that person or the patient is behaving such a way. So when you get, or in a common language, we say you get into their boots and you understand the situation. So that's a common thing that we discuss now. When you go into the really in that patient's position or the person's position, then you understand, okay, you most of the time you feel fair the behavior of the other person, even if you have got already annoyed. So that's the easy way to live life. Patients are often arrived with the prejudice ideas. When he comes to you, they have analyzed, may not be in the hospital, but if the patient has come to see you, patient has already a preset mind about you. He's a good doctor or a bad, right? If he's a bad doctor, he won't come. Most of the time, he's a good doctor. But if in the hospital, sometimes when the patient comes, if the patient has got bad experience, especially from the clinic or even from junior, and if the patient has got some evidence, anecdotal evidence from the social media, or their bad experience from their friends, they have a bad experience. This applies mainly to the private, not the private sector, but in the government sector. Prejudice idea, this fellow is not a good doctor, but because I am helpless, I am coming in. So that is how sometimes the patient sticks in the hospital. But in the private sector, always they have positive attitudes when he comes and meet you first time. But if you have operated or have got a complication, all those things, negative things tend to recall, right? Then initially, even if they had the good impression, easily they recall the information or friend's bad comments or anything. And the first piece of information they receive from the previous doctor or online, or then they go into the net and see what they have said about this doctor and all that. Even a minor thing, they will exaggerate, the patient exaggerate themselves and take the decisions. Keep that in mind, very important. Most of the time, those are anecdotal and irrelevant and in proportionate, not disproportionately exaggerated by the patient. But that is the patient's nature. So you are in a different higher level. Understand that when you deal with the patients. And on the other hand, try to understand the patient himself has a lot of other anxiety running in their minds, because anxious about the outcome. They are not sure about whether the surgery is going to be good or bad. Frustrated by the symptoms, chronic symptoms the patient has been suffering, and already even if they come to seek solutions from us, is already suffering from a lot, and with that in mind only patient comes to us. So feeling of a loss of control, this is very important. Being a medical setting, a patient is helpless. Even a well-educated or a professor comes to us, or a top-class politician comes to us. They all at that moment, feel less powerful, less empowered, or compared to the guy, or on the other side, that compared to the doctor, because they are clueless. Or else some people just go through the Google and find various things, and they come and say, doctor, that is how it's been done, it is how it is done, I have seen this and then various things. And especially people traveling from overseas also, they come and say various things. But all those things are, you should not take into your emotional state and don't get confused with those things. Try to understand the patient's situation. I had never blackguarded a patient, even if they, we call in our language panditayas, or even if they panditya. But most of the time, I have listened to a lecture in American Academy. One guy in America said, how to develop your practice. This is long ago when I was a senior registrar. I went to USA, and he said you go to the patient's level, and in fact, how much he went to go into the deep level. Your chair has to be lower than that the patient's chair. I don't agree with that, but what he said was indirectly what he was trying to say is that you go to the level of the patient. Not in the level, but you discuss with the patient, come to the patient. The patient should feel that you are a friend of the or a same colleague or a same person at your level. Then patient opens his mouth and then discuss. This is applied in everywhere, in psychiatry, medicine, wherever. It applies to ophthalmology as well, because it's a part of it. So always try to be friendly with the patient and let the patient to open himself in front of you. Who are the difficult patients? Anxious or fearful patients, aggressive or angry, and sometimes, where a patient comes to you, the patient is nicely talking to you, and there is a guy watching outside, you know what this fellow is doing, sometimes it irritates. The bystander probably or a accompanying person is looking at you to find fault, or sometimes they are holding the phone and recording what you do. Don't get angry because it's not our problem, it is their problem. So whatever you say, whatever you do here, even if it is open anywhere, so that's okay, no problem. So in that manner, you have to work, right? Whatever you say, whatever you do, should be, even if it is divulged to everybody or outside people, you should have to do that in a manner that you will not be embarrassed when it is exposed, only the patient, right? So some patients are demanding or entitled, non-compliant or uncooperative patients sometimes. Whatever you say, even when you're examining, it's not cooperative. When you ask the patient to look, you then look at the direction that you say. Very uncomfortable. You cannot do a 3 mirror there. I know. But don't get agitation, because if you become agitated, if you become stressed, then it's very difficult to proceed from that point. And sometimes psychiatric patients or other illnesses, unrealistic expectation. Patient first time you ask, Dr. මේක කරොත් කොහමද? guarantee කරන්න පුළුවන්. So most of the consultants get annoyed with that, including myself. I used to, and one of my teacher, very senior teacher, very famous guy in country, but his answer is okay. ගැරන් කරන්නද? ඔයා ප්ලේන් එකේ නගිනකොට අහනවාද මේ ප්ලේන් එකකින් ගිහිල්ලා බස්සනවාද කියලා ගැරන් කරන. අයි අපෙන් විතරක් ඕක අහන්නේ. But I initially I believe that's a good kind of a explanation or a question asking back from the patient. But now I don't think of that. So you say very politely, okay, what can you guarantee? In a lighter way, you explain the patient, you cannot guarantee. So they accept that. So a lot of patients have unrealistic expectation, but you have to explain the patient how the realistic things. And secondary gain seekers, the patients comes to you, and this is very important for especially for the juniors. And some patients come to get they don't have any issues, but they come to get a medical, or they come to get a medical to the court, or from medical legal issues, or else sometimes they want to go get out from the job early, retirement. You want to get the patient condemned like that. Don't get caught for those things. You never do those kind of things. From the beginning of your life, as a professional, set your guidelines. You don't do unethical things. You don't issue false medicals. Whatever the money that you get, even if you lose the patients, in the long run, you get your name get established that guy is not a person like that. The never patients come to you. I never get a patient and ask that kind of medicals and all those things now. But from the beginning, yes, I got. So they come from word of mouth, just like the patients comes to you from word of mouth most of the time. Even for those things, the patients come in that direction, that way. So don't get initially set your guidelines, because if you try to limit those things later in life, if I try to set my guidelines now, I will lose a lot of patients. But because I have set certain guidelines and developed that kind of patients up to now, I have no issue. So set your guidelines in the beginning, very important. And your communication is very important. The way that you talk, your tone, and how you explain the patient, that's very important. I'm coming into details in that. What are the common triggers in ophthalmology if the patients get irritated? Give me one minute, please.
Hello. Long waiting times.
Sorry. So abnormal noises came from that side. I close it. Okay. Common triggers in ophthalmology: long waiting times. Number one. So most of the time, if the patient you has to wait long, patient get irritated, and pain or discomfort during the procedures also causes patient get agitated. Fear of vision loss, as I said from the beginning, and cost of the treatment also important. And you don't have to do things for cheaper, but so you have to be careful when you when you deal with the patient. So that is also important. So, and this is especially important in the private sector. But even in the government sector, you have to be very careful, and you have to have an idea of how much costly the each item, because you may have seen in the theaters when we were registrars trainees, how many times we just try to get the gloves and like this damage, you throw it away, and you take another one, you take six, or you try various sutures, you throw away, but those are very costly and someone else's tax. So therefore, you have to be very careful in dealing with the cost factor is important, right? Repeated procedures or lack of improvement in the vision. That is especially this is important when you have a complication. And at the same time, kind of this Avastin injections, laser treatment, those are also important. Laser treatment, Avastin injections, repeated injections you have to give the patients. The patient asks why you are giving so much of injections, there is no improvement. The moment the patient, sometimes the patient comes and sit in front of you, agitated mood, I have given, when you say you have to give another injection, the patient says, you have given so much of injection. Doctor, you have given 5 injections. So what to do? Then you have to take little time on those patients and explain the procedure. Okay, this is how I explain. There are patients whom I'm very big, top, high ranking officers in the country that I have been giving more than 30, 40 injections because they are dependent on that. Otherwise they go blind. But I clearly, slowly tell the patients, this is how I explain. Then I tell the name. I also don't want to give this injection. I mean, I feel what you are feeling. This is something that I also hate to tell the patient that you have to give injection again. But unfortunately, if you don't give this injection, you are going to be blind. The day that you go blind and you come back, I will be helpless. You will be helpless. You cannot do anything beyond that. So then the patient will realize that, and the patient understand. Yes, and I add in addition to that, I say wherever you go, anywhere in the world, this is the available treatment. Ophthalmology is nothing, fancy, nothing magic. Everybody does the same thing. If you go to Anuradhapura, that doctor also does do the same thing. If you go to US, same thing. And I also do the same thing. So this is any eye surgeon. You don't have to have an extra skill to treat your condition. So this is the protocol that we have to follow. Then the patient accept, and that patient will never ask the question again. So that is how you explain. So these are very important things, even though we don't realize. Uh, so you to tell, and at the same time, tell the truth. If you have to give the injection, tell the patient, even if he doesn't come, what to help. They right. Communication strategy. This is where most of the doctors, not only ophthalmologists, fails. Communication is very important. Number one is active listening. What is active listening? Anyone? Erosion is there. Erosion is erosion. What is active listening? Oh, කවුරුත් කතා කරන්නේ. Okay, if nobody says, I will say what active listening. Active listening is you just not listening like that. When you listen a song or something, you get into that. So you feel it. So same thing. You listen to the patient, agree with the patient, understand properly and show that you are listening to that. While the patient is talking to you, if you try to do some texting to other person or tell the nurses or look at the nurses, then it is not active listening. Patient will not develop a trust with you. Empathy and validation, it has to be genuine. You have to you have to feel the empathy the patient. At the same time, validate what the patient says. If patient says, I'm really suffering this and cannot be, I'm fed up. Yes, I understand. Otherwise, you're not the head. So to show the patient that you understand what he say and you into that patient. That is very important. These are practical things that you have to do, and setting polite boundaries. If the patient is trying to, okay, doctor gawa gaya, so and so doctor patan gatta memai salli gatta mechara kaawa kila. When you start the patient, politely say those things are not important here. They will discuss the factor, the important thing related to you. So that is in the past. No point discussing the past. That is how you somehow bring, you set the guideline, you set the communication direction, but involve with the communication. That is very important. And after that, patient is never try to, blame the other doctors, and you are also safe, because otherwise, if you say something, is a slight mistake, that exaggerate and go and say, next time that patient go back to the same surgeon, if the surgeon has done something. So he will go and exaggerate. Your colleague will get annoyed with that with you. So therefore, very important, without, don't let your communication go beyond the boundaries limited to your problem, because you are developing only a doctor-patient relationship, not a friendship. That is very important. Friends only discuss other things. Here you discuss the matter only or related to that, the patient's problems. And patient, manage the patient's expectations very early. When the patient comes to you, maybe cataract surgery, maybe retinal surgery, tell exactly, the patient say, "Mata picture, I bowl golf kahano, that all that." But tell the patient slowly. So I do, yeah, 100%. If I do 100 patients, 95% you will get what you say. But always doctors can make blind, and sometimes things can go wrong. These are human bodies, not robots, not exactly calculate things. That way you put your communication and say there is a 5% or even a little more than that. Some people can go blind. So then the patient, expectance suddenly goes down. But you have at the same time, it's a positive communication. You have tell that majority is like that. And finally, you say, yet, if you don't do the surgery, you are not going to gain anything. Your vision will, deteriorate. And finally, you have to do at a date where the complication rate is more, when the cataract is mature or when the retina is bad and beyond operation. Sometimes that way you explain the exact actual situation. Because if you try to, get the cataract to you and promote the surgery, never promote the cataract surgery to get for you, because the patient goes to the other doctor says, especially if come to me, this is what I tell my patients for the cataract surgery. I don't hardly those patients know what other person said, and I will say, okay, doctor, is it urgent to do the cataract surgery? I will, no, nothing is urgent. Cataract surgery is done when the patient wants. You have a cataract, it has to be done. But if your vision is okay, if you are happy with that, your cataract is not going to make a big difference in 1 or 2 months' time. Even if you come another 6 months' time, I can do the cataract surgery. That's how I tell the patient. Then the patient develop the confidence with you. The patient comes and get it done with you. But I would, at the same time, I will tell, if you wait, your cataract become harder and the surgery make it little difficult. I will be able to do that, but it will make difficult. Cataract complication rate, even if it is mine, is more than what if you do it now. So then the patient very politely, nicely, you have put what you want to say, tell the patient. And it has to be genuine, not to get the patient to you. And always try to explain in a simple language and visual aids. That is why the drug companies have given you, various those models and all that. Use those things. And even if you are busy, I always talk those things when I try to explain the retina and all that. Explain with the help of those models or pictures, whatever available there. Try to make the patient understand. Very important, that one, because you have to explain the patient and see whether patient understand what you are trying to do, and then get the patient involved in the making the decision. And it has to be shared decision. It is, especially in practice in other countries, it is not a doctor's decision. Whether to operate or not is not decided by the doctor. It is a decision taken by the doctor and the patient both. And what lens to be put, again, tell all pros and cons of various lenses, and then it is also decided by the shared decision. So then patient, when you in this small scenario, make the patient feel that he knows everything what about the surgery and all that, and then the patient takes the decision most of the time, and then he is responsible if something goes wrong, and the patient will never come back and fight with you. And this communication bridge that you make, the doctor-patient relationships here, is very important in the long run, because even if you go wrong, the patient will never, patient will never say bad about you, and it will say, accept that it is a mistake, or it is something that the doctor explained to me. This is unfortunate. It is my fault, the patient's fault. That is what patient most of the time expect. They take it to that. So always be like that. So this is what I was telling, and there are a lot of articles for this active learning. When a clinician actively listen and express, that they have proven, give me 1 minute. They have proven that it activates patient's prefrontal cortex and promotes the trust, and that trust is long lasting. But if after that, just like diabetic, initial first 5 years of diabetic control is very important. It keeps the memory, what you call memory, and the forever diabetic control is very important in those things. Now it is something that similar in this case, even though the example is not exactly matching here also, the first impression, like the first discussion that you and the patient has developed here, will last long, even if you make a mistake or even this complication comes. Don't try to make mistakes, but even if a complication comes, and in the signals and the patient feel that the patient, why the patient develop that trust. Patient thinks that this doctor has understood everything my problems, and he genuinely try to solve my problems. Listen and talk second when the patient talks. So you listen first. Let the patient talks. Sometimes patients start from 5 years back, a ball hit my eye, and then it was treated in the eye hospital, and then went to that doctor, and then up to the chief doctor, and various things. And after that, I was perfectly all right. Don't get annoyed, don't after when let the patient to start the talk. But after some time, when the talk is dragging on, you have 35 patients over 50 patients outside, then slowly say, okay, I don't think any of those things are related for your problem now. Those things, those doctors have treated you, and you have been lucky. And now what is your problem now? Even patient have forgotten what has he have been talking. Down you patient directly jump onto the then current problem, and that is how you deal. Like that. Don't never argue with the patient. And reflective statements also important. That is to say that when the patient says something like, either you nod the head, or, oh, okay, I understand. Tell the patient certain things with the reflective statements, means to show the patient that you understand things, what he said. Make a confirmation statement, so that. And it is very important to, it is completely understandable or feel anxious for surgery. Validate their emotions. When the patient struggle, and I don't matter what way they buy, I understand what you say, but don't worry. I have been operated so many times. It don't happen. I have seen patients like you, so many patients like you, and nothing has happened so far. I don't know whether it will happen to you, but I will go forward. There is nothing, no option. Then the patient quickly turn into that. And very important to set the realistic expectations. That is the important, especially guys who do retinal surgery or a cataract, whatever it is, the realistic expectations. That is why people say under promise, deliver more. Always try to I don't approve that very much under promise, but if you explain to the educated person very much clearly, then the patient will be happy. But under promise is also an important thing, especially kind of a low people who has very high expectation. You promise, even if you do cataract surgery, you have to use sometimes you may have to use glasses for distance and for near both. You may get sick. Most of the time, your patients, I know most of your colleagues, our people surgery now, they get sick, but don't tell that. So promise less, you will have to wear glasses for distance and near both. And then the patient is very happy with no glasses for distance and near only. So they are very happy with that. And teach back method means that when you explain things to the patient, make sure the patient understand it, right? So ask whether, okay, do you understand? Otherwise, tell me how you put the eye drops, glaucoma drops. Ask the patient to demonstrate it. The patient will put the finger here on the nose, right, like that. So the patient, because the patient is under stress, they will not understand. It is like that. It is like how you teach the condoms to use the condoms. There's a famous joke, no, how to use the condom. The midwife comes and they show the batter in or the stick and put the condom onto the sticks, showing the fence. Make it a dala. So you have the sex, and then you will control your birth. And the person put the condom onto the sticks, and the next time also when the midwife come, there is a child at home. So that kind of thing, communication is very important. Tell exactly, ask whether the patient is understood it, and ask sometimes certain procedures, demonstrate the patient, so that this thing is important. So shared decision making, which I told you, very important, because the responsibility is together. And this is a proactive discussion and potential complications and variations. This is what I explained in the previous slide. So most of the time you get a good results, but there could be certain deviations. And if unfortunate incidents, if the patient falls into that unexpected results, still patients, aware. Patient will never go to courts against you. This is very important nowadays. Because why it is important, as long as you are doing the correct thing, the patients are with you, your colleagues, the rest of the patients, everybody will be with you. The moment you deviate, the moment you make a mistakes and you are fired, everybody will be against you. Suppose I get a complications, then now people would say, take X, not me, take X eye surgeon. He doing so much of cataract, so much of retinal cases. Very good, has a massive practice, excellent work. I have seen the eye surgeons talk like that. I have seen his cases, it's a very good. But the moment the few cases get infected in a list, that is why this should not be done like that. That case fellow is doing so much of cataract, and it should not be done because it infected the whole thing. Then only our own colleagues, our friends, even though not in front of you, the whole rest of the world will be against you. That is, keep in mind. This is how this profession is. Not only the medicine, in any profession, that is only the professional relationships. The moment you make a mistake, the whole world will be against you. As long as you are correct, everybody will be with you. So keep that in mind. Don't get disappointed when you come to in that fight. Then I have seen consultants that happen not in ophthalmology, but I have seen in other fields, especially in Ragama area, how certain people get, uh, victimized because of those attitudes of the profession. And this is also important de-escalation techniques, especially when there is an argument, when there is, unwanted discussion with the patient. Patient is arrogant or angry with that. Never go, provocate that. You are the big boss, and I have done everything correct. That talk is not applicable in that place. When faced with an agitated patient, maintaining a calm and a demeanor using a specific verbal strategies can prevent the escalation. A calm tone. This is an article that I saw when I was looking through the internet. A calm tone and open posture can reduce the perceived threat. So you show the patient, even if you fellow shouted, I have not done any mistakes. I have done my duty, with a kind of a calm. Don't laugh at the patient, but calm and quiet, undisturbed posture will help the patient to, take his foot back and try to discuss. These are scientifically proven things in communication. So therefore, you always be calm and professional state. You have to be even though the patient is like shouting at you, you cannot go into this level and shout, because that is something that very bad among today. I'm sorry to say these things. I'm not referring to a specific person, but when you may understand today's doctors are not some of the doctors are not at that level, you cannot call them active sometimes. Now, they know big difference between the three-wheeler drivers and some of the doctors, because when they come to argue or discuss or fight, so that is not, we should not go to that level. We have to avoid that and avoid the argument. You don't, no point arguing with the patient at any moment, because what are you going to prove? And this was actually taught by one of my colleague. He is Dr. Loganathan. He is not here now. He is in US, my colleague. We got to the exam together. And he told me one day, because I was fighting with a patient. And then he came to me and said, Machang, in single broken language, Machang, no point fighting with the patient. My father used to tell me, when you drive in the road, you never fight with three-wheeler fellows, because he is in a different level than you. So that stuck on my mind up to today. I never fight with a patient. Even if I fight with the patient, from outsiders cannot see that I'm fighting. I'm very politely smiling. I tell what I have to tell the patient, and patient also will not get agitated. Those are important things in even in life. And when something goes wrong, when there is a problem, patient comes to you. No point showing the I have done so much of surgery, I have that and this. These are things that happens in our community. When a patient, I know that there was an endophthalmic patient, one of my friends endophthalmic. The patient went to another private hospital. The doctor there, he took the patient and explained why you have got endophthalmitis. If you do that surgery here, you won't get the endophthalmitis. No point, doing that. It's not here, but is no point explaining that, because nothing will go to the patient's mind at that time. Patient's main issue is he has trusted you, and you have a better reputation than the previous doctor come to you, and keep that reputation. Even if the patient, they get the vision back and come to a good mind and then thinks back what this doctor said, it has to be professionally acceptable for that person also. You don't know who the patient also. And by trying to explain something, your good or your ability will never bring more patients to you, because it won't, that patient will never go and tell anywhere. So very important to maintain that level of communication. So no, don't try to explain what happened to you. Try to give a solution to the patient. Why patient comes to you? That is one critical, very important, basic question when you ask from doctors. Medical students, especially, I have not got a proper answer. Very rarely I get a proper answer. Patient comes to you because patient has a problem. What problem is immaterial? He has a problem. That problem has to be settled. The patient comes to you, doctor, mage aha cataract kala masa dekai khasana khandulu wena. Value perfect. 6 vision. No problem. No dry eye. The patient says khasana. What ledak ne amma yanda karadara karana. What is it correct? No. The patient comes to you paying few thousand rupees, taking extra time, and with the bystander or somebody with great difficulty from Matugama area come to Colombo to get treatment for you, Kasanava, because that patient has a problem of Kasanava, irritation. So therefore, you have to address that patient. Even maybe it is a psychological this thing. Right? So one patient came to me. This is very important message that I'm trying to tell you, which I also make this mistake sometimes, are very rare. Patient came to me and patient says, I can't see. When you check the vision, everything is fine. But I see certain areas, black, and because the patient has been given PRP, and while doing the PRP, the doctor has got a call. And patient has, while answering the telephone through the Bluetooth, not because you guys are listening, frankly, this is not our colleague, one of our doctors. It's not, if I tell you that you will understand who the doctor is, but it's not Sri Lankan doctor anyway. So, but it's in Sri Lanka. So the doctor has answered a call coming from overseas, something related to their personal issue, was continuously while doing the PRP, patient has answered that call. patient now, he has got a psychological impact that the eye is damaged by laser, without focusing on to what he was doing. So I had to take extra effort to explain that. I don't know whether even the patient realized what I accepted what I said. After that, patient didn't come to me also, because now patient is prejudiced. Patient says that fellow did damage my eye, and now patient wants to go with somebody who says, yes, your eye is damaged, but I didn't want to do that anyway. So very important that, give the solutions. And if the patient is continuously abusing, you cannot calm down. There are certain things, some people, very, very arrogant, or sometimes, try to come to always try to find fault with you. Then best thing is to stop that communication. Either you say, now I have to, shall we discuss it some other time, or else you say, okay, if you are really telling, we'll meet another doctor. You take a second opinion, go to this doctor, and then come back. And like that, you somehow to avoid the discussion. Or you cannot say time out. I have no time. You cannot say now. But in other countries, there your time is, I have to attend something and can go straight away. But here you cannot do that, because then they get further agitated. But you say politely, somehow avoid that discussion later, because the patient, everything settle with time. That is also an important thing. Most of the things settles with time. This is also important. That is why, in that crisis moment, if you pass that slowly, or those crisis or agitated states of both doctor and the patient will dilute, and later on they come to terms with you, and try to settle the problems with you. And the important thing, even if this patient is shouting at you, the patient still trusts you, and there is no option. He has to come to you. That is why the patient is coming to you. That's also keep in mind, important. This is also important. Efficient clinic flow. This is either in the government hospital or in the private hospital, wherever it is. Efficient clinic, the environment is, or the teamwork is important. Long waiting time sometimes irritate the patient. You also go about 1 hour late, patient already there, and you take a lot of time to see the patient, because you cannot cut down the time sometimes in the patients. But the outside patients are irritated when the patient comes in. Yes, they happily goes back. But so try to be efficient in the clinic time, and your supportive staff is very important. Now, I have seen even in my clinic, sometimes what happens, the nurses, they in front of you, when you see the patient, they are very kind to the patient, because they are just they are getting working for a low salary, and they are not interested in this field. They are doing their job to enjoy, get the salary. So they are waiting just to finish this thing, and fed up for the whole day. When by the time we go 4 o'clock in the private hospital, they have been working from morning. They have to work till 10 o'clock, and they are fed up. So they are anyway, but can't help. You have to tell them, you have to be kind. So even if you tell, they may not be kind. So therefore, what you have to do is, they may not be kind. What you have to do is, you have to be vigilant as a consultant. You have to look around and see everything what is happening outside. If the nurses are shouting at the patients, on and off, you have to uh, be watchful about that. If the patient are shouting, call the nurse, not in front of everybody. Tell the patients, if your mother comes, try to explain and educate them on their language, not by shouting or anything, because they hate you otherwise. And a very important, the patients to have the clear communication channels as well. Now I say, go to OPD and go to vision care, do the biometric, take the lens from the pharmacy, go to OPD and go to the theater. I will come and operate. This is how. This is in a brief. This is what I have to tell at Navaloka for cataract surgery when they come. But the patients are clueless. Patients don't know where vision care. There are two vision cares. One is at India Hospital Vision Care at Navaloka. One is in the town hall. Therefore, you have to tell everything very clear way, clear pathway, because the patients totally, it's like going to a foreign country when they come to another place. So you understand, when you go to a totally strange place, how you identify things, even though it is very familiar to me. For the patients, it is not familiar. So therefore, you have to give clear guidelines, and there has to be, proper pathway to follow for the patients. That is very important. And this is another important thing. Yeah, sometimes, this is the first question when I did my internship. when I did my internship in Ragam, I went to, I don't want to mention the consultant, he's a good consultant. And he asked, I would say he's a smart consultant. You know, he knows how to escape from anything. So he asked from me, who is your first patient? I said, the first bed. No. Then I was bit, thinking laterally, I thought it is the hospital staff. So I said, the sister in the ward. No, then I said hospital director like that, but finally everything went wrong, and he gave me the answer. Your the most important person, not the first person, the most important patient is your BHT. Treat the BHT well. So indirectly, what he was trying to say is that don't do it. I mean, not to cheat, but document everything what you do. And yesterday also we had a discussion with a patient in a group, retinal surgeons and senior surgeons involved. In that group, there was a patient put by one of my friend, and there, he wants to give an injection to the patient. Clinically, yes. By looking at the OCT, you can, you can give with experience, you can give an injection, anti-VEGF. But I argued on the other way, no, you don't have to give injection. And I put a similar patient on this thing and said, this is my patient. I don't give this because I have already done an FFA and there is no leak, there is no subretinal neovascularization. You can be misled. So therefore, whatever you do, you have to have evidence to do, because we do evidence-based practice. We don't do Edamahatya type of, treatment. So you are doing evidence-based practice, if the patient cannot afford it, then give the patients to choice. Tell you that, these things have to be a document on that. If the patient doesn't do that and the patient wants to take our experience or our expert knowledge and trust us, okay, go forward. But then you have to have document on the ticket. If you have to do an ICG or if you have to do an FFA, write that. Do it. If the scenario or the situation cannot do it, that's okay. But you have mentioned and you wanted to do that. You are safe when something happens. And that is also important to repeat the key information when the patient comes in visit. You have to explain important things, putting the medicine continuously is important, and multi-visit counseling also important. Sometimes the patient decide ERM peeling, especially when the patient wants to do the ERM peeling. Patient first day comes, not decided, go home, so come, okay. Next time also tell the same thing, maybe. The patient comes and pay, not free. So, okay, explain. Again, explain. You can't say, I have explained previously, so if you want to do, you do, otherwise not do. Patient won't come back to you. No point losing that patient. Not worth for the patient and not for you. I did a very stupid mistakes recently. Yeah, sometimes even if you say like this, sometimes this is genuinely what happens to me a few days back, 3 days back. And a patient, I saw a patient, and that patient has to be has to undergo vitrectomy for TRD in one eye and the other eye laser. I wrote that, but just I need the proof, no. So because when the patient goes with, after I do a proper surgery and make a complication, patient goes to the other person, and there is no justification why I did the vitrectomy on that eye. So I have to have proof. So I said, do the OCT, do the color picking photo, and come to do the surgery. Patient went to another eye surgeon, and the patient, without showing my documents, and did the same thing. The doctor also said the same thing. We are nothing rocket science here. No, we all know what is exactly every ophthalmologist are more or less equal. No, so he also said the same thing, and the patient was referred to me. And then patient came back to me and say, then I don't know why I got annoyed. Sometimes, you also get tired. And the nurse came and explained to me, we asked to so and so and various things. And then I got annoyed. I said, you don't trust me. Go to another VR surgeon. I mentioned the 2 senior VR surgeons' names and the junior VR surgeons also. And they are definitely better than me. They do a lot of cases, can said like that and sent to me. But the patient was not going. Patient was waiting outside. After that, I somewhere, I said, got the patient back. I said, I was not angry. I never heard the patient. I said, why I got the patient back? No point punishing that patient. That patient was upset, and he was, confused. And because of that, he tried to take a second opinion. I always tell the patient to take a second opinion. That's a very important thing. But a second opinion, but without hiding my documents and all that. Tell that I have seen and go and take a second opinion. But this is something different, because he want to double check with the doctor. No, that sort of things are not good. So I said, you don't trust me. So even if I do, very difficult to satisfy you. That is why I didn't want to do you. But if you are okay, I will go ahead. That, and I reassured the patient I will not do anything. And I did the surgery yesterday night. And this is also important, a legal and ethical consideration, consent and treatment. If the patient doesn't want to, you right. If you see certain senior surgeons, then we get referrals from senior surgeons. Sometimes retinal cases, they are that he refer to retinal surgeon and explain this and all that, because he write everything, and he didn't do that. And very clear notes most of the time, especially my teachers, they're very clear notes. Even if I do a blunder, he will not be in trouble, right? So they're very important to write what you do, and do things that you can write. That is very important. Do things that you can document. Don't do anything that you cannot document, and document the things that you do. Very important. The complaint handling also important. Sometimes the patient comes and complain various things, your regarding your staff, or regarding your previous doctor, his previous doctor. You have to handle it very carefully. And on the other hand, you always be with the patient, but understand that what he says is may not be correct. Recently, one old lady came to me, late 60s patient came to me and said he was manhandled inside the theater, and it's a complicated cataract surgery. I had to take the lens out. Manhandled by the theater. Therefore, please look after me, doctor, in your theater, like that. Very gently told me. And later on, actually, that is very bad. Now, when doing males handling the lady. So even if it is she old, so I was very upset. I told the hospital director and all that. We said, and then to see, we check the CCTV also. That's very, I mean, it's a total lie, because the patient wanted extra care from me. So that kind of thing also can happen. So listen, but carefully, but you take things, after realizing whether it is really true or not. Can be total lie. So these are important. These are patients. And when you stop treatment, also that is important. So, for example, if a patient is going to get NPLI, or corneal ulcer, you cannot do anything. So then everything is finished now, painful blind eye. If you are going to do the different treatment, you have to remove the eye or these things, very have to take a second opinion, because very important. Otherwise, you will be in trouble. And when you stop, that's also sometimes the patient, you cannot do anything. Blind eye, patient comes to you regularly for symptomatic treatment. That patient will not bring money to you, but it is not correct for you to discourage. You have to address that issue, because it's not ethically correct otherwise. This is something that we most of the time make mistakes. Retinal surgery, yes, sometimes poor outcomes, but they don't go blind. But tell the truth to the patient. Glaucoma, non-adherence treatments, compliance is poor. Why? If the patient is given treatment for ischemic heart disease, patient takes patient. They are not non-compliance. Even if they are, not having pain, not after not taking the medicine, still their compliance is good. This is a proven thing. But for glaucoma, very poor compliance. One reason is us. We have not explained. If you don't do that, you go blind. And two things, only two sentences make the patient compliance. Until you are blind, you will never notice this. If you don't read, you go blind. By that time, no one else in this world can be helped. You can help you. Patient will continue medicine. Number one. Number two, very important. explain how to put the medicine and ask whether the patient understood it. Many patients, when I ask how you put the, press the lacrimal sac here, punctum here, somewhere here. Similarly, when patient do in congenital nasolacrimal duct massaging like this. So that is not correct. No, so you have to explain the patient, because that when you are telling the patients to do that, and you do it on your eyes, and the patient will, patient is anxious, and especially parents are anxious. In children cases, they will not. It won't go to the patient. By the time you go out of the hospital, the patient can't remember exactly what they do, what they want after that. Therefore, make sure that the patient do it in properly. And oculoplastic also. This is cosmetic dissatisfaction. The patient, patients need to tell the outcome from the beginning, and especially these two cases, retina and cosmetic, the oculoplastic surgery. Yes, you may under promise and then deliver more, and then the patient are happy. That is very important aspect, because most of the time you cannot, you don't know how these skin contractions and all that happens, especially in cosmetic surgery. So therefore, tell the patient that sort of things, and you are safe. And cataract, sometimes you get a patient comes, I told you from the beginning, six vision, very good vision, and patient comes to you and unhappy, despite perfect surgery. But still, there should be something to be unhappy in that patient. You have to find that cause and address that issue. The patient is happy, and patient comes to you forever. That is also important. Working with the team is also an important thing in this. This is something that we fail most of the time. Oh, role of the nurses and counselors are important. The nurses have to be very, friendly with the patients, and they have to work for you, right? They should know in the team, in this your setup, you have to make sure your staff is working for you. Otherwise, if they are trust, they respect you, they work. So you have to behave in that way to make sure that the patients respect you, and do that. For that, otherwise, what happens when you are not there, the calls will not be answered well, and the patients will not be explained well. Rude this thing, and polymane shouting at the patients. Those things are not encouraged in your clinic. I mean, that discourages your practice. Even is not good for your practice, whether it is in the hospital or in the hospital. And very important thing, I have been repeatedly telling my trainees when I meet trainees, especially at Javadarapura, never discriminate whether you are working in the hospital or whether you are working in the private sector. For the patient point of view, treat the same. Both are patients, treat the same. You will be, that will definitely come back to you. And very important that whether you are working in the hospital, whether you work in the private sector, no difference. They are patient, and the staff also same. Right? But certain procedures may be little different, but treat the same, treat the both same. And very important to identify the nurses to in the ophthalmitis cases and all that. Patients comes to you, waiting outside, shouting. Sometimes so the corneal ulcer or endophthalmitis patient waiting like that. They are good people, sometimes without disturbing you, waiting outside. It's not good. So therefore, if the nurses don't recognize the patient, quickly you have to take previous day list. Patient is suffering, so you have to take those things. Sometimes the patient is fainted, old age patient, especially in the outside, waiting for cataract surgery. Those things should be identified by the nurses. You have to have qualified nurses there. That's also important. Saves your life sometimes. Recently, one in the hospital where I am also working, one patient, went heart arrest without notice. Heart arrest. But fortunately, the patient was not taken into the theater. But outside, the patient got a heart arrest. Patient died. Not on the hospital, the patient was moved to the next hospital, but in that hospital, patient died. Not good. So it would have been recognized. So, that's important. So this is also an important factor. Your staff have to be looked after by you. You earn a lot of money by giving some, money of attending their these things. This is done by most of the people, is important. But be very careful among your colleagues when you treat. These are things that happens when you treat. You have to be very carefully select what you do and it has to be, if you are working with other consultants, your colleague, ophthalmologists, they all should know what you do with the other staff, because otherwise there could be a misunderstanding, you promote the patient from the reception and all that. Don't let that happen, and don't do that also. Never give them those things for the reception, if you, especially where the patients meet first, to select the patients, and then if you try to do those things, the patient, you will be more promoted by those guys. It's not good, it's ethically not correct. And if you are do a common thing with everybody, those things, and let the other surgeons also aware what you do, then no problem. Otherwise, it's not correct. But when you inside your room staff where you work with you can look after them and treat them nicely. And when you have a complication, that is also important. Complications are happening to everybody, not for you. And sometimes, when a very VIP patients, you get a complications, what to do with those things are happening to everybody in ophthalmology. If you don't have complications, you are not operating. So the only complications happen to doctors who operate. So it happens to deal with that. I can remember, I don't mind telling the name also, my good friend, long time back, Shaminda did a cataract surgery when I was a registrar. Patient got an endophthalmitis, but the way that he dealt at that time, the patient came and told in front of me, if I have to get my cataract surgery to other eye cataract surgery, I will go back to the same doctor. So the patient has developed such a trust even after, evisceration of the eye. So that is the relationship that you have to develop, that kind of relationship, because it's a complication accepted. He has done the best to the patient. So that is how you develop that kind of thing. And very important to do the best complication. At the same time, seek an assistant. Never break the relationship, because the patient, even after complication, if the patient comes to you, even after surgery, if the patient comes to you, unhappy patient, but yet come to you because the patient expects solution from you, still trust you. That never break that relationship. Very important. And especially, and the other thing is that, and if you, especially when you are starting your career, don't try to do fancy things or brave things, because yes, if you do brave things, you can, get a good publicity, or you can improve your practice. But at the same time, your chances of making your mistakes is more. The once you make a mistake, the disaster that you, or the damage that you get is much more than what you are going to gain from doing that case. Therefore, give it to somebody who, handle difficult cases. Later on, you also will get a place to, you come to a level where even if you make mistakes, the patient will accept that is not a mistake. That's, something happens. Even a fall of a dancer is a somersault kill. There is a saying, so when you are experienced, the people will accept these things. But when you are young, even if you have done the correct thing, the patient will not accept those. Therefore, be careful at what age and what sort of things and things. Identify difficult patients, especially when it comes to those things, and select carefully. That's also important. And recognize your personal triggers. Everything you do, like, after 50, 56, early 50s, you get a heart attack. So no point. So personalize your things also important. And this second point, focus on what you do. Like Amila said in a previous a presidential speech, he said, focus on what you do. This is a wide topic, very important. I many times most of the time I practice this. I'm not on telephone calls while operating. I just do, when I do the capsular exercise, I focus on the capsular exercise. I can achieve nice capsular exercise. I know where my things is go. Next step, I know I'm doing chopping. So you enjoy that work. Very important. You can do not 60, 100 cases at, one go without getting tired, because you enjoy that. That is also very important. You enjoy what you do. So enjoy, focus on that. Sometimes, jogging, or climbing trees, or climbing, going here and there, doing exercise. Those things also sometimes hobby in certain people. So same way, if this is the hobby, you can do it as long as much as you live. People will say, don't work like that, you will be burned out, you will get a heart attack and all that. No, if you are enjoying that, it won't make you tired. Enjoy the surgery. I enjoy surgery. That is also, so therefore I'm very happy. If I don't have surgery, I get depressed. So that is important. And maintain your professionalism. I don't want to go into details of what professionalism is, and these things. And that is very important because we tend to do bad things. Our mind is like that, unacceptable things. But same way in maintaining professionalism is not easy. The tendency is to deviate from professionalism, but harm that you get from deviation from that much more than gaining from being in the professionalism, practicing professionalism. That's very important. So finally, I'm trying to wind up giving you to ask questions by leaving these two sentences. Dealing with difficult patient is one of the less glamorous yet extremely important aspect of your ophthalmic practice. You do like this, but it's not going to uh, make you glamour, but nobody will notice that. But it is very important. It is often said that medicine is an art as much as science, and nowhere is that more evident than managing human behavior and emotion. Never treat a patient a case. It is not case. It is not numbers. It is a human being. He comes come to you with a problem. Solve that problem so you are happy, and that happiness make you healthy as well, and the patient also is happy. So with that, I give the opportunity for you to ask questions because Salih Patirana sir was here. Patirana sir. Patirana sir, any comment to add? Muted.
Mangala, have you got any questions in
No,
text?
actually, I must thank sir. It's a very good lecture. Actually, when I was working with him in 2010 in Jawadharapura, so yeah, I'm very excited and happy to assist him in VR surgeries because he's telling a lot of things. And I can remember he's taking me to see the patients, come and asking me to watch how he address the patient. So that is very important. Say, come, I know, monkey so that is very important, and he taught me a lot of these things those days, and I'm very grateful. I'm using these things in my practice as well, and I take this opportunity to thank him. Thank you very much, sir. This is a very great lecture. I think very interesting.
Thank you, Mangala. It's a good comment, but these things are done by most of the trainers nowadays, and you also have to do the same, continue the same thing when you come to training centers.
Salvin, it is nice, very nice.
Thank you.
Daya,
Thank you.
Daya.
Oh, I know.
Me.
You think I can't recognize your voice? My teacher, we had the lunch together. My ROP guru.
ඇත්තටම මේ young කට්ටියට දැන් they get agitated when they get some with the complication, so they should learn actually from the beginning how to talk to them, how to handle them, and how to seek advices rather than getting they get agitated otherwise. So that's a good guideline. So that's, I think, it's a good thing. People can add more afterwards. Thank you, Sal.
Thank
And
you.
other Salvin.
Yeah.
And actually, we want to thank you because this is a very challenging topic and often overlooked by many, and it's very difficult to even discuss. And we know you are the one of the most capable person to discuss because you do this practice. As Mangal said, we also experience, and it's a subject that many would not be discussed freely, and yet very important and relevant into present day practice. That is very important. Thank you once again, and for your time and your expertise.
ඕක හැමෝටම කියා දෙන්නත් බෑ සැල් වගේ නේද?
Yeah, exactly. Yes.
අපේ කවුරුත් නෑ නේද මේ අපේ own colleagues ලානේ ඉන්නේ.
Yeah, all ophthalmologists and trainees. Nothing to worry.
Rangika, any comments? Rangika sir is here.
Yeah, he's also muted and.
Muted ගොඩක් කට්ටියකනේ.
Yeah.
Okay.
Patirsi is around them by the way, yes. I see the SP. Maybe Sagar Patirika, I don't know.
Thank you very much, Kusum. Shall we wind up?
Yeah, sure. And thanks everyone for joining us and have a pleasant night.
How many people was there in the lecture?
Well, about earlier it was
20.
24, now it's almost 24, 27. It went up to 27.
27, yeah, it went up to
Nice,
27.
very healthy
Yes,
number
sir.
in the Sunday.
Good. Thank you very much.
Yeah, it's great.
Thank you.
Thanks.
Bye.
Thank you, sir.
Bye-bye.
Thank you very much.
Thank you very much, sir. Thank you.
Bye.